I'm Rachel Hawkins, and I'm the founder of Angler Insurance. Q4 of 2025 was rough. I've been doing insurance for 17 years, and I've never seen anything like it. Most groups were getting anywhere around an 18% rate increase, all the way up to a 43% rate increase. So it was the first time that we've really seen employers say, wow, we have to pass more money on to our employees of what they're paying, and they're finally opening up their eyes on there has to be a better way. When I find out that an employer is ready to make a change to their health plan, that is when I look at, all right, let's bring in Imagine 360. I know that they're ready to make a change and they want quality care for their members. They want a partnership that's going to be above and beyond through a transition and really make sure that it's going to help save them money when it comes to the end result of what they're trying to achieve. Some of the key things that we can discuss about how we can save money on their health plan and tackle the cost is one, your network. Are you paying for a network that's paying the physicians top dollar, or are we willing to negotiate that network and look at something like Imagine 360, who is going to provide an open access and pay a fair price for the service? That is going to be something that's not only going to save the company, but it's also going to kind of create this new baseline and standard of the cost of care. Another item would be pharmaceuticals. I really think that's kind of low-hanging fruit, that if someone is on a high-end drug, is that employer getting the pharmaceutical rebate attached to the drug? I think a lot of employers, when they ask me about self-funding, they're like, ooh, it's complicated. Well, it can be, but it doesn't have to be. It's basically, you have all of these components in your health plan now. You just don't see it. You just see one package, and then when you look at self-funding, it's you get to customize all of those puzzle pieces, take them apart, and put it all back together again. I think partnering with Imagine 360 has made a huge difference within my business. It has allowed us to expand the daily conversations that I'm used to having with one-on-one employers on a larger platform. We're going to educate. That makes it easier when a consumer feels confident about, I want to finally make this transition with my healthcare. When you partner with Imagine 360, it's amazing the support team that they have that's going to be like, hey, we got you, we got your back, we're going to help you. I think that employees and their experience with Imagine 360 is like, wow, this is great. I didn't really notice a big difference from my fully insured carrier. They saw their ID card changed, but at the end of the day, they're able to go where they want to go and get the care that they need. I have one client who has held their rates the same for the last 3 years. And that's kind of unheard of right now. But that didn't go without effort in trying to make sure we're controlling the costs of the claims as they're incurred. And you can only do that if you're self-funding and you're willing to work with a partner like Imagine 360 that is going to really work alongside you and achieve that same goal that you're looking for. I want to encourage other advisors to reach out, learn about Imagine 360, show it to your clients. It's only going to continue the good work that we're doing.